Hi, my name is Anika Majaria and you're watching Dubai Live TV. I'm here at the American Hospital with Dr. Ibrahim, who is an anesthesiologist. Hi, thank you for being with me today.
Thank you for having me here.
Can you tell me a little bit about yourself and your role as an anesthesiologist?
Sure. Well, I'm a consultant anaesthetist at the American Hospital in Dubai. We provide anesthetic service for a wide range of surgical specialties. We provide anesthetic service to labor and delivery ward. For example, we give labor analgesia for women giving birth, or we give anesthesia for women having cesarean sections. We provide acute pain management service throughout the hospital. We run anesthesia clinic where we see patients for consultation before their surgeries. We assess them, we make sure they are fit for their operation, we prepare them and explain to them what they expect to have on the day of the operation.
What attracted you to anesthesiology as a profession and how long did it take you to qualify?
Anesthesia is very, very unique specialty in the sense that you see applied physiology, pharmacology and physics in everyday practice. You see, if in medicine, if you give your patient a tablet, nothing might happen. You might have to wait for a week or two to see the difference. While anesthesia, I decide which anesthetic agent I'm going to use for the patient. I calculate the dose based on their age. Then I give the medicine through an intravenous cannula, and within seconds, bang, the patient is asleep. And this is fascinating. And the same thing is during the operation. Let's say the blood pressure drops, then I have another medicine and I give it, and within seconds, the blood pressure goes back to normal. Heart rate goes up, another medicine, and it goes back to normal. And this is very unique for anesthesia.
What types of patients do you deal with?
All right, all kind of patients really, from few months old babies to many years old adults. Those patients can be in the hospital for an elective planned procedure like a knee replacement or a hip replacement, or they can be in with an acute illness, being sick with acute appendicitis, an example, needing an emergency surgery, or having multiple trauma after being hit by a car, needing a loss of operation. Those patients can be young, fit like me and you, or can be with a very complex medical problems like complex heart issues, lung issues, diabetes, high blood pressure.
What misconceptions do people usually have about your role?
One of the most common questions we get asked, especially in the anesthesia clinic, patients ask me, okay doctor, so you're going to put me off to sleep, then you're going to go off to your next patient. So how do you know I am asleep throughout the operation? How do you know when the operation is going to be over? So you can come back to wake me up. And of course, I have to explain that to patients, that we don't leave them at all. We see the patient before the operation. We make sure they are prepared for their operation. We put them off to sleep. We look after them through the operation, second by second, beat by beat. Make sure they are stable and they are safe. At the end of the operation, we wake them up. We take them to the recovery room, and again, we make sure they are stable, they are safe, they are pain-free before we leave them for the next patient.
Could you talk to me a little bit about some of the technological advances in your field?
Well, there's no doubt medicine in general and anesthesia in particular evolved significantly over the last decade or so. Every day we have a new medication, new machines, new technologies, and I have to say that the most important and significant development in anesthesia in recent history is the safety of anesthesia. Anesthesia used to be very dangerous, but today we have machines which can monitor every single vital organ function in the human body throughout the procedure, second by second, again, beat by beat.
Thank you so much, Dr. Ibrahim, for being here today.
It's a pleasure. Thank you very much for having me here.